Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left third molar. The ID canal needs to be isolated and extraction has to be performed on this case. So this is the panoramic view. We can see on the panoramic view that the inferior alveolar nerve seems to be in close association with the lower left third molar. The lower left second molar is grossly carious as well. The lower left third molar is grossly carious. Now, when we look at the tooth from a transaxial view, the blue line is going to denote the long axis of the tooth. So this is the tooth from the mesial aspect. So this is the mesial aspect. As we move slightly distally, we will see that the root, this is the inferior alveolar nerve. I'm going to hide it for our kind doctor. Sorry. Right, so this is the inferior alveolar canal. A little bit about the anatomy. When the inferior alveolar canal is not completely rounded, it appears to be compressed by the roots, and that means that it is very much in close contact with the nerves. Now, if we move further distally, we see that the inferior alveolar canal thins out even further, and then as we move, this is the interradicular area and this is the distal root, and we can see that the inferior alveolar nerve canal is completely compressed, and slowly as we move towards above in the ramus, we can see that the complete architecture of the inferior alveolar canal can be restored. So here I'm going to take you back slightly. This is the distal root. The inferior alveolar canal is compressed towards the lingual aspect. This is the interradicular area, and then this is the buccal root where the inferior alveolar canal is compressed as well. And as we move towards the 7 and the 6, we can see that the canal architecture is restored. So this is a very significant finding in this CBCT, because at the time of extraction there is a significant risk for damage to the inferior alveolar canal. We can show you from a axial point of view. So this is the right hand side, this is the left hand side where my mouse is. I'm going to zoom in, and now we can show you if we are moving down from, this is the crown structure, this is the crown, this is the wisdom tooth there. As we are moving down, we can see that because of the angulation, that now at the root level we can see that the inferior alveolar canal right there. And as we move, the inferior alveolar canal slightly slides to the lingual aspect, and this is the canal here, and it is in close proximation with compression of the canal cortex. And as we move even further apically, we see that this is where the canal is present, that very close to the lingual cortical plate. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.